time to finally realize we the people must make some choices. If we want health care for all, now's the time to raise our voices.
I want to first acknowledge that we are conducting this meeting on native land here in Seattle. We always do it on Duwamish land, but as this is a statewide meeting, there are many tribes whose lands we are conducting this meeting on, and we want to make sure we're acknowledging that we are meeting in the aftermath of the murder of George Floyd by Minneapolis policemen on May 25th. It sparked a massive outpouring of rage and grief and demands for justice across our state and our country. In the midst of this pandemic, mass gatherings of protests and healing only add to the extra risks borne by communities of color that are already hit disproportionately by COVID-19. So at this moment, we really want to uplift Black Lives Matter, Seattle King County, for direct community support and assistance. So please follow BLM Seattle King County on Facebook for events, actions, and racial justice resources. And also, we are going to have a follow-up email that has those details for you to click on. As for us, healthcare is a human right. We are a community, labor, healthcare, and faith-based campaign to guarantee healthcare for everyone in our state and in our country. Right now, we have a great meeting set up for you guys. I'm going to hand it off to Rachel Erstad of SEIU 1199 and Faithiya Abdi, the Community Health Network, and they are going to give us an update on some of the work and how it reflects on health justice and racial justice.
So I just wanted to highlight what happened this weekend. I know some of you may have already been aware and already took part, but there was a healthcare for workers justice march last Saturday, and it drew about 10,000 folks. I was there. It was a beautiful sight to see individuals in their scrubs, in their lab coats. It was just, I mean, it was heartwarming. It started at Harborview all the way to City Hall, and it was organized by Dr. Estelle Williams and her husband, Edwin Lindo. And people came together just to really recognize that police violence is a public health issue and that racism is something that should be on the forefront of everyone's mind, regardless of what we are working on, and should be a public health emergency. So there was a list of concrete demands that have been supported by every dean within UW Health Sciences, as well as a variety of advocates. And those demands were delivered in a letter format to Mayor Perkins, as well as Inslee, as well as the city council members. So I can just go over real briefly what those demands are. I believe the sign-on letter is still open. I checked it this morning. They haven't closed it. So if you would like, I can put that link in the chat and you can sign away. But just to give you an idea of what those lists of demands are, it's immediately declaring racism and police violence as a public health issue, immediately ending violence against protesters, that we stand solidarity with them, eliminating any legislative provisions that shield law enforcement officers from investigation and accountability, ensuring that there is some sort of public disclosure of all investigations of law enforcement officers, brutality and excessive use of force, and ensuring that all of that material is made public through an online database, reversing the militarization of law enforcement, funding studies that explore the effectiveness of interventions that may decrease reliance on law enforcement, making sure that we have programs that are funded that meet the fundamental needs of humans and promote healthy and strong communities and help reduce structural inequities, advancing equity and justice by eliminating officer enforcement of regulations designed to marginalized people, and engaging in a review of law enforcement agencies policies. Those demands, again, were outlined and sent to our leaders. We haven't received any responses from our elected officials, but we are hoping that individuals keep on pressing them to meet those demands. I see that someone has already put the letter in the chat, so thank you, Chris. But yes, so if you can sign on to that letter and try to contact our elected officials to ensure that gets heard.
Right. Rachel Erstad?
Yeah, so on behalf of SEIU 1199, I just wanted to thank Healthcare as a Human Right and all the groups associated for a lot of support through a recent bargaining campaign we had. So through our bargaining process, up to and including a strike that many of you participated in, coming out as individuals or coming out on behalf of different organizations, our members decided to make the very needed approach of utilizing a racial justice lens through this entire bargaining process. So we did culminate in a strike at Swedish in January. Members were on a 3-day strike as well as a 3-day lockout, and members talked about this as being a strike for racial justice. This really did, how we approach this in bargaining, how members approach this in bargaining is centering the most impacted members as well as patients, and examples of wins that members were able to get to in this contract include backup child and elder care, protection from being sent to collections for unpaid medical expenses, and the bargaining team also took on the fight for and won better staffing language for all job classes, including environmental services, a department at Swedish Providence that is largely composed of women of color and immigrants. And other wins in EVS, very needed wins, include home area assignments, the ability to use all break rooms, a commitment to filling vacancies, and an escalation process to raise staffing concerns in real time to get more of an immediate solution. And in regards to break rooms, a practice that was happening at Swedish prior to the contract and the discussions that members were able to have directly with management was EVS attendants, environmental service folks, we were being asked to go back to an environmental service specific break room, opposed to the break room of the floor or the department where they were cleaning. So when you have a 30-minute break, I'm sure this is very clear, you could spend upwards of 15 to 20 minutes getting back to a break room that's potentially far away from where you work directly. We also want equity and inclusion language that includes data analysis of resignations, disciplines, and termination based on race and other identities. So our members at Swedish, as well as our members at all of our chapters, are viewing this as a start, and as an organization, we have committed to having an anti-racist approach, or working to have an anti-racist approach through implementing a racial justice lens, and not just bargaining, but in the work that our members are doing to stand up to their employers to make sure to have a say in the work that's being done and in direct care that's being done across the state and also in Western Montana. And thank you again to Healthcare as a Human Right for your support during this whole process.
Thank you very much, Rachel. I neglected to mention one thing about Rachel and Faithiya also. I want to make sure that I mention their Healthcare as a Human Right roles. Rachel is on our steering committee, and Faithiya is the co-chair of the policy committee. So definitely want to mention that. And that'll set us up with a little bit of a segue here. Healthcare is a Human Right, headed up or led by, in this case, Healthcare for All Washington. We spearheaded a sign-on letter that was signed on by 72 organizations supporting the Healthcare Emergency Guarantee Act, which would guarantee affordable healthcare for everyone in our country during this pandemic. We want to thank all the organizations in this meeting that supported this effort, and we are so proud that the prime sponsor of this bill is our own Pramila Jayapal. And we are going to have a video right now from Pramila.
Rachel Berkson. Hi, I'm Pramila Jayapal's district director. And I think David had just asked me to give a reason as to why she's not here. in person or live on video. As we've been discussing with the murder of George Floyd, the protests around police violence, and anti-Blackness that's happening, the Congresswoman is preparing for a big hearing in the Judiciary Committee meeting that's happening tomorrow on this issue, the Justice and Policing Act. So, but she did put together a video, and I think we're going to play it right now.
Good evening. I'm Congresswoman Pramila Jayapal, and I'm so proud to represent Washington's 7th Congressional District in the U.S. House of Representatives. I'm sorry that I can't be with you live this evening, but I want to thank all of you at Healthcare as a Human Right for being true partners in the fight for universal healthcare. Please remember, during this time of tremendous upheaval, when I know it can be tempting to feel overwhelmed and helpless, the fight for universal and comprehensive healthcare for all is deeply interconnected with the fight for racial and social justice, and it is deeply embedded in the way forward and the way through the COVID-19 pandemic. This is an unprecedented global public health and economic crisis, one that has made it even more clear that we need Medicare for all. COVID-19 has exposed and widened the cracks in our healthcare system, the cracks that allowed 80 million people, or nearly half of all adults under 65, to be uninsured or underinsured in this country even before the first case of COVID-19 arrived in America. The cracks that put 500,000 Americans into medical bankruptcy each year. And we have to be very clear that the effects of this crisis, disproportionately felt by Black, Brown, and immigrant communities, are tied to the long-standing violence and systemic racism these very same communities experience. In the past 2 weeks, we have all witnessed the protests that have spread across the country following the murder of George Floyd by Minneapolis police. But the anger that Americans are feeling right now is not only George Floyd's horrific murder, or only the deaths of Breonna Taylor, Ahmaud Arbery, Tony McDade, and so many others. It is also anger that has understandably emerged from generations of racism, oppression, and broken promises in every part of American society. It is anger that Black and Brown communities are disproportionately experiencing a quadruple pandemic of COVID-19, of economic devastation, of police brutality, and of a hateful president advised by white supremacists to promote racist policies. Consider that Black and Brown Americans are much more likely to be uninsured, more likely to die during childbirth, and have a lower life expectancy overall. Black Americans have nearly 3 times the odds of being hospitalized as white Americans and are nearly 4 times more likely to die from COVID-19. We just saw in May's unemployment report that economic conditions are the worst for people of color, especially Black women and Hispanic workers. Let's tie this back to what we see in the streets. It is sadly unsurprising that George Floyd had been laid off during the pandemic and that George Floyd tested positive for COVID-19. You see, our causes and our solutions of these crises are completely intertwined, like so much else. In order to heal our current economy and the persistent economic injustices embedded in our systems, we must be healthy enough to get everyone back to work. In order to stay healthy, it still means staying home. And in order to stay home, people need paychecks and money in their pockets to put food on their table and pay rent and mortgage. So let's be clear. We have to ensure that everyone has access to necessary life-saving health services without worrying about becoming bankrupted, particularly in the midst of a global pandemic. The House just passed a $3 trillion relief bill, and yet I believe that bill failed to ensure health security for millions of Americans. And that's why I have introduced 2 proposals to alleviate the challenges that we currently face with access to healthcare during this pandemic. The first is a Medicare Crisis Program bill, along with Congressman Joe Kennedy III, which would expand Medicare and Medicaid eligibility so that anyone who qualifies for unemployment insurance will now also be eligible for Medicare. I've also co-sponsored another bill with Senator Bernie Sanders, the Healthcare Emergency Guarantee Act, which would allow Medicare to cover all costs for those without health insurance and all out-of-pocket costs for the underinsured until the Department of Health and Human Services certifies that we have an FDA-approved vaccine for COVID-19. And my Paycheck Recovery Act is a healthcare bill too. It keeps workers in their jobs and allows employers of all sizes to be sure that they can make payroll with benefits so they don't have to lay off workers, and they can allow workers to continue to get paychecks and have access to healthcare. Let's not forget what we are all fighting for every single day. Medicare for all, so that no one ever loses their healthcare because they lose their job in the first place. And as you all know, I'm the proud author of the Medicare for All Act in Congress, and I will never stop fighting to get this passed. We are in a moment that history will look back on and ask us, what did we do in the face of crisis, injustice, and unspeakable corruption and inaction on the part of our leaders? What did we fight for? Did we advocate for bold, courageous, and urgent changes to prevent the deaths of more Americans from deadly disease, despair, systemic racism, and anti-Blackness? Did we push and challenge those who told us to take justice one tiny step at a time instead of the way we need to, boldly? I am confident that with partners like Healthcare is a Human Right campaign, we will have chosen boldness and courage. And boy, do we need that now more than ever. So sending you love, justice, and a deep commitment to fighting for universal healthcare for everyone. Everyone in and nobody out.
Thank you very much, Pramila. Now we are going to move on. Colin Goldfinch. He's from Senator Patty Murray's DC Health staff. And Colin is going to talk about his work and some questions we have for him.
Well, thanks so much for the opportunity to speak with you today. I'm very glad to be able to tell you about what Senator Murray's fighting for here in the other Washington. It's no secret that COVID-19 has laid bare problems in our healthcare system, from Trump administration sabotage of healthcare to disparities facing communities of color to the high cost of healthcare in general. As soon as we saw the first cases of COVID-19 here in the US, we also saw patients getting stuck with huge bills, including by junk health plans. These are plans that the Trump administration lets discriminate against people with pre-existing conditions. Senator Murray and her colleagues have forced several votes in the Senate to try and prohibit the sale of these plans, only to be blocked by Republicans. The administration has also had the opportunity to reverse course in their lawsuit to overturn the entire ACA, and they didn't. In other words, President Trump's lawyers are still arguing in court to take coverage away from 20 million Americans and eliminate protections for 130 million Americans in the middle of a pandemic. That's why last month, Senator Murray and her colleagues led the entire Senate Democratic caucus in an amicus brief to the Supreme Court defending the law. Another major concern is the disproportionate impact that this pandemic is having on communities of color. Part of the problem is that although we have some facts to understand how communities of color are being disproportionately affected, we actually don't have the full picture because we aren't collecting enough good data. In the last COVID bill, Senator Murray fought for and won a requirement that the administration issue a report on health disparities in COVID outcomes. After the administration initially published a totally inadequate report, Senator Murray kept pushing, and last week the administration announced it would collect infection data by race, ethnicity, age, sex, and geography, among other things. Now, despite these serious problems, Senator Murray is still focused on finding solutions. Paid sick leave is one example. You probably already know that Senator Murray has been pushing for years for a federal paid sick leave policy. And in March, she and Representative DeLauro secured 2 weeks of paid sick leave for workers with COVID symptoms and workers who need care for quarantined family members. That policy is temporary, but it helps workers and families right now, And getting Republicans to agree to even a temporary policy is an opening that Senator Murray is going to use to fight for her full paid leave legislation. Despite those initial wins, there's obviously a lot more to do. That's why it's so frustrating that Leader McConnell doesn't show any signs of bringing the HEROES Act up for a vote in the Senate anytime soon. The HEROES Act would provide funding for testing, for contact tracing, and for struggling healthcare providers. It would ensure free COVID-19 treatment for patients, no matter what kind of insurance they have or whether they have insurance at all. And it takes steps to prepare for an eventual vaccine. HEROES also provides help for people on COBRA coverage, and I know that's something this group wants to discuss. So to be clear, paying COBRA premiums is not a panacea, but record numbers of Americans are losing their insurance, and the Trump administration isn't doing anything to help. Senator Murray has been hearing from a number of groups, especially unions, whose members are worried about switching coverage and potentially having to switch providers. They feel strongly that paying COBRA premiums is one solution to keeping folks covered, and Senator Murray is interested in pushing for as many solutions as we can find to get and keep people covered throughout the pandemic. I also wanted to address the Healthcare Emergency Guarantee Act. Let me start by saying that Senator Murray agrees that COVID treatment should be covered free of charge for everyone, regardless what kind of insurance they have or whether they're insured. And she believes that, especially in light of this crisis, cost shouldn't be a barrier to people getting the care that they need. This bill was referred to the Senate Health Committee, and as a ranking Democrat, the senator generally doesn't co-sponsor legislation that comes before her own committee. That said, I want to assure you that Senator Murray is fighting hard to ensure that people have access to COVID-19 treatment and testing and healthcare more broadly during this difficult time. The Families First Coronavirus Response Act took an important first step by requiring all insurers to cover testing without copays or deductibles or other barriers like prior authorization. But it's clear that more is needed. Senator Murray recently issued a white paper with several of her colleagues, including calling for all treatment to be covered free of charge and for a new national special enrollment period. And she's glad that many of her colleagues are coming up with ways to accomplish these objectives and wants to continue to work with them. Senator Murray believes that Congress can and should do more to combat this epidemic, but part of the problem is also a lack of leadership from the Trump administration. Testing here is a great example. Senator Murray wrote a white paper on testing in April, outlining ideas to push the federal government to dramatically ramp up testing capacity when it became clear that the administration wasn't stepping up. She fought for and won a requirement in the last COVID bill, forcing the Trump administration to issue a testing strategy. Unfortunately, the Trump administration's strategy, published last month, fell far short. It didn't include any of the step-by-step goals that Senator Murray expected. So Senator Murray is going to keep fighting to hold the Trump administration accountable for its lack of leadership, and she's committed to continuing to work with all of you to demand better for Washington state and communities across the country that are struggling with the coronavirus pandemic. Thanks, and looking forward to the discussion.
State Senator Joe Nguyen out of the great 34th Legislative District. He is going to talk about what's happening in our state. We have a lot. That's a whole nother quagmire and can of worms, and we're really glad to have Joe with us to help guide us through what we can do to help be part of the solutions for a lot of the stuff we're dealing with right now. So thank you very much for joining us, Joe.
Thank you so much, and it's good to see so many familiar names on this call. It's hopefully soon we'll be able to actually get to hang out in person. It's been quite the time these past few months. As we were leaving session, the pandemic had just started, but it hadn't really taken hold yet in terms of the scope and scale. And when we were leaving, we initially thought that we'd be fighting just a pandemic, and then it turned into what quickly will become a recession and a budget crisis. In addition to shortly after the West Seattle Bridge, where my district is in, is not in good shape, obviously. And then, of course, in recent weeks, we've seen with the injustice, the continual injustice of Black lives in America. So it is quite the time at the moment to be in the legislature, but I am hopeful. We're very lucky in Washington state that we actually have, at the very least, democratically controlled legislators, because we've seen in other states what happens when you don't. And that kind of worries me for a couple of reasons at the national level as well, which I'll touch upon real quick. I think one of the things that I want to talk about here today is the need to not have an austerity measure when we come to the legislature again, either in a special session or in the regular session. If we talk about healthcare and the holistic person, we need to make sure that our budget reflects that as well. In 2008, I think a lot of folks may remember the recession back then. They took a cuts first approach towards the balancing the budget, hoping that the federal dollars and also the recovering economy would help. It did not. And what ended up happening was we saw some of the worst wealth inequality in the history of Washington State. So they took a cuts first approach, left all the tax exemptions intact, didn't raise any B&O rates for larger companies, and kind of went off. And because of that, we've seen a lack of funding when it comes to housing and essential needs, affordable housing. I personally believe that the reason why we're having a huge issue with homelessness and affordable housing is because of what happened back in that time. And I don't think we should do that again. So myself and some other legislators are working very hard to ensure that the conversations are focused on how do we invest our dollars in the smartest way possible, because that really is a reflection of our values, right? So just to give you an idea of the scope and the scale, the governor asked various agencies to at the very least prepare for what they believe they might need to cut if it was like a 15% cut, which isn't the case, but that is kind of what we're facing right now. And if you look at just, for instance, higher education, it's about $310 million if you were to cut that much money. So the number of students who would be able to afford to go to college obviously would decrease, and we would see disproportionate impact in what that looks like. Early learning and foster care, that would be about $155 million that you would cut. Nursing homes and human services like TANF and basic needs and foods, that's $500 million. And then administration for aging and long-term support, that's $222 million that we could potentially lose in the next biennium, which would be absolutely devastating because these are the people who absolutely need it the most. And I'm not just one where I think we need to have revenue commensurate with the cuts, but I do think we need to invest more wisely as well. We're seeing that certain industries have been impacted more than other industries. So for instance, small businesses, hospitality sectors, the restaurant industry. I've talked to a lot of stakeholders who just need funding to help get back going as well. And this is one of those moments where, in like healthcare, we need the federal support to make this work. Without support from the federal government in 2008, the cuts would have been drastically worse, and that was about $8 billion. Given the Senate that we see now at the federal level, and given the person in the White House, I don't know I have a ton of hope in terms of being able to get support, but that's why November is going to be so important. And that's a huge factor into kind of how we do this. So given that context, right, that looks like about a $7 to $8 billion shortfall over the next 3 years. So about $7 to $8 billion shortfall over the next 3 years. And just as a reference for folks, Jeff Bezos, just him by himself, since COVID has started, he's made $24 billion, right? So the shortfall that we have projected is $7 to $8 billion over 3 years. In the last few months, he's made about $24 billion. So it's about 30% of that. So in my mind, I'm not calling him out just because of the background, but for the most part, it's because I believe that we have the resources and funding to get that done here. And that looks like, to me, things like a high earners payroll, where essentially if you make over a certain threshold, it'll be a marginal tax on top of that. That was discussed last year for some other things. Capital gains, I absolutely believe that we need to pass because it's the right thing to do and it's progressive. We could also touch upon estate or inheritance, and you would structure it in a way where it would only be a certain threshold that's over, right? So for instance, capital gains or whatnot, you wouldn't include retirement accounts. You wouldn't include primary homes. You would only make it for the ultra rich, because as you can see, there's enough of those folks here. So the biggest things we can do is make sure that we push back, talk to your legislators, talk to your LDs, and make sure that the people that are in power understand that an austerity measure is not going to work. It didn't work back in 2008. It won't work this time. And that we actually are very lucky in Washington State, where we've invested well and we have an abundance of resources here. It just needs to be treated equitably. So I don't want at all for us to have to use regressive taxation to cover some of these gaps. But I do want to make sure that those who have benefited from this great state pay their fair share. So that's kind of a quick update of kind of what we're thinking about and what we need to do to make sure that we are able to have quality care for everybody here in Washington.
Thank you very much, Joe. All right, that sets us in motion for me to hand it off to Sam Hatzenbiler of the Economic Opportunity Institute and Faithiya Abdi. I mentioned earlier, Faithiya is one of the co-chairs of the policy committee, and Sam is the other, and they are going to lead the discussion with our panelists and representatives of elected leaders. So I'm going to hand it off to them. Thank you very much.
All right, thanks so much, Nathan. And I'm starting my video. Thanks, Larry. So thanks so much to all of you for your excellent comments. And we've had some good questions come in through the chat. So I'll be sending them to each speaker, and also feel free to respond and speak to each other as speakers. We encourage that. First question is for Rachel Berkson. So Representative Jayapal addressed the importance of healthcare being accessible to everyone, and of course, particularly during a pandemic. Can you talk more about the Healthcare Emergency Guarantee Act and what we can do to advance it?
And I saw there was also just a question on whether you had to switch providers. I don't know if I saw that in the chat. The answer to that question is no, you do not have to switch providers. The Healthcare Emergency Guarantee Act just helps supplement any out-of-pocket costs you have, whether you're insured and you have out-of-pocket costs, as most people who are insured do, or you're uninsured or underinsured. So this is a program that helps cover those costs along, and is complementary with the other act that the Congresswoman mentioned and that she's been pushing forward, the Medicare Crisis Program as well, to help make sure that during this time people aren't paying for COVID testing or treatment, but our programs of Medicare and Medicaid are picking those up. And in addition, I do want to mention as well the Paycheck Recovery Act that she mentioned, which is a bill that she's been pushing to help keep people on their payrolls and keep people on their jobs, which will help keep people on their health care as well. And at the same time, as she's trying to respond to this crisis, she's also continuing to make the case and push for Medicare for all and her on the broader scale as well.
We've had a few questions come in for Colin, for Senator Murray. In your remarks, you talked about the HEROES Act and touched on the COBRA piece that we are concerned about, that COBRA premiums are being paid to private insurance companies by the federal government rather than providing universal coverage. So I'd love to hear you talk more about the HEROES Act and that piece in particular about the COBRA, but also what your sense is of the prospects for getting that passed.
Sure, absolutely. So just to clarify, as I'm sure many of you know, the HEROES Act was a piece of legislation written in the House of Representatives, and that's passed the House of Representatives, but that hasn't been brought up for a vote in the Senate yet. The Senate has sort of continued to do what it's done for the last several years, which is, confirm Trump nominations. So that's a real source of frustration for Senator Murray. She knows that there's lots of folks in the state and across the country who need help and need it now, and feels very strongly that the Senate should be taking up, this legislation and other legislation, not only to address the coronavirus epidemic, but obviously also to address the police misconduct issues that we're seeing across the country as well. So for the COBRA piece in particular, that is one policy that was included in HEROES to provide payment for the premiums for either health plans that are operated by an employer or by a union, or the private coverage that's purchased on behalf of an employee by a company or a union. And as I said before, I think there's no question that policy is not a panacea. That's only one policy among many in the bill to try and address the various different aspects of making sure that folks are able to get the treatment and testing that they need for coronavirus treatment and testing. And the main argument that we've heard for that policy is to just minimize disruption in coverage and care for folks. That in a worst case scenario, this is just an example. If somebody literally loses a job while they're in the hospital, that there's no question about who's paying for their care while they're there. That there's limited to no paperwork needed to make sure that they sort of sustain coverage on the same plan. And so that's the point that I was trying to make.
Thank you. And a follow-up question for that would be, if the Healthcare Emergency Guarantee Act comes over to the Senate, will Senator Murray support that bill?
Yeah, so this was what I was mentioning in my comments as well, and happy to clarify that. So there's a companion bill to the legislation that Representative Jayapal introduced in the House that was introduced by Senator Sanders. And as soon as those bills get introduced, they get referred out to the various committees in the Senate for consideration. Not surprisingly, that legislation was referred to the Senate Health Committee, and Senator Murray is the ranking Democrat on that committee. In general, because legislation that gets referred to her committee may come before the committee, she has a policy of not co-sponsoring legislation that's going to be brought before her committee. But as I was saying, she absolutely supports the objective of making sure that folks are not paying for coronavirus testing and treatment. Now, the Family First Coronavirus Response Act already required that folks are not going to have to pay for testing. Although, if there are folks out there who've had to pay for a test, we absolutely want to know about it and want to follow up on that. But there's more to be done because that didn't address treatment, which is the sort of next step that we have to take. She absolutely supports that folks should not have to pay for coronavirus treatment, and recently published a white paper, as I was mentioning, with several of her colleagues expressing exactly that. And so, definitely look forward to working with all of you to achieve those objectives.
Thanks so much for clarifying. And I just want to give a moment here to our steering committee member, Gina, who has a question. And
my question is for Colin again. And Colin, you touched around the outskirts of my question, but I'm going to ask it again to get more specific clarity. How can we be sure that Senator Murray will be a champion on guaranteeing healthcare for everyone in our country during this coronavirus pandemic? And I'm mainly concerned with specific groups of people, like undocumented, like people incarcerated, the homeless community, people who are generally left out of the equation of healthcare overall.
Thanks so much for your question, Gina. I really appreciate it. So as I said before, Senator Murray just recently issued a white paper that included a whole list of policies to make sure that more folks can get connected with coverage and to make sure that their health care is getting paid for during the pandemic. That included a number of different policies in it, but one of them was to make sure that nobody is paying for coronavirus treatment, no matter what kind of insurance they have or whether they're insured. There's a number of different ways to do that, but largely through mandates on the different sources of coverage to require them to pay for folks' treatment without cost sharing. And currently there's funding available to pay for folks who don't have insurance. With that said, we should obviously be pushing for more than just payments to providers to provide treatment to the uninsured, and Senator Murray absolutely supports that. She recently, to the question of undocumented workers, recently co-sponsored legislation that Senator Booker introduced in the Senate called the HEAL Act, which would expand Medicaid and exchange eligibility that's currently not available to a number of different folks in the undocumented community to make sure that they're able to get and afford coverage.
All right, I think we're going to come back to you, Colin. I wanted to give some time to some questions for Senator Nguyen. So let's see, we've got some great questions here. One question from Bevan. What tax loopholes can we close now that would generate progressive revenue as we continue to work towards capital gains and others?
Yeah, no, I think one of the easier ways, if you want to target specific industries that are profiting handsomely, is actually through the B&O. So it's not necessarily a loophole, but I would probably adjust B&O rates. Microsoft pays a different rate than Amazon because selling software is different than selling stuff online. So I would revisit what some of those might look like, and largely because I think small businesses are the ones that are hurting. So agnostic of exemptions themselves, what I would probably do is I did some math last year on our tax structure, and 75% of businesses in Washington State make under $250,000 per year in gross revenue. So you can actually feasibly reduce taxes for 75% of business in Washington State, and increase B&O rates in a marginal amount for very large companies, and actually be still whole. So I would probably advocate for something more like that. The exemptions themselves, there are good ones like Boolean and whatnot, but it'd be kind of more piecemeal. So doing a more holistic B&O approach, I think, would be easier, but also politically viable as well.
Thank you. And also on the issue of progressive revenue, question from Roxanne about the state income tax. What about implementing the state income tax and dropping the sales tax?
Yeah, so I actually don't believe that income should count as property, and I wasn't a Supreme Court judge in 1929, right? So if I was there back then, I probably would have said something different. Right now, with the current rulings that are in place, unfortunately, we weren't able to get the hearing for the Seattle's lawsuit that came through that had a pretty favorable finding in the local courts. So the easiest way to get something like that would be a 1% flat rate income tax, which is not necessarily progressive, but still would actually be significantly better. And then you would have, in conjunction, a sales tax rebate. So then you would pay less on that front as well. So that one's a bit tricky because, unfortunately, that one would get sued, and it would work its way through the courts. So it probably would take minimum few years before it got figured out, and that's in the best case scenario. And that's kind of why the excess compensation bill that I talk about is kind of a de facto income tax on high earners. It's on the payroll of the companies themselves and not on the individual. So it's completely constitutional and achieves kind of the same goals.
Thank you. And a question from Pam. What are the barriers to creating a state bank, and what solution?
Yeah. I actually just wrote a white paper on that. So I'm working with Senator Hasegawa on infrastructure bank, so a state bank, and kind of what that might look like. The Constitution of Washington, again, is also weird. You can't give gifts of public goods. And there's parameters around debt capacity as it relates to how much the state can lend out. So if you had a bank that was fully backed by the state, it would be kind of problematic because you then have less funding to do other capital projects. But what you can do is a co-op bank sponsored by the state in terms of the operations that you then can lend out money for local jurisdictions. So if you were a small rural town, even in Burien, say for instance you're just in Burien, you're not big enough to go out to the market to get a large bond because that requires a lot of resources and energy that you may not have as a small jurisdiction. You can feasibly go to a state bank and get funding to build a community center, to build a library, to work on the infrastructure in your area. And this would augment some of the work that's being done in other spaces within the state. So there's a public works board as well. So that's limited to very specific projects. You can have an infrastructure bank or a state bank that then will lend out money to local jurisdictions, including the state itself. And that way you can boost the economy as well. So I think that's actually one of the viable. I wrote a paper that I sent to the governor's office and some of the budget chairs of a recovery plan. And one of it includes making investments that are rooted in economic opportunity for disproportionately impacted communities, but also in green projects as well. And that requires having, I think, a state bank. So there is a plan for that. That is very, so the one that I wrote, I tried to navigate around as many constitutional requirements as possible. But yeah, there is a conversation about what that might look like.
Thank you. I want to return to Colin here. We've got some pushback here and requesting more discussion on the Healthcare Emergency Guarantee Act. A few comments here that the the act would cover all healthcare, and folks are saying it's an efficient way to make sure everyone can access affordable care, not just COVID care, and to address racial disparities. And just hoping you can talk more about that.
Sure, absolutely. I mean, yeah. So what I was simply trying to say before is that Senator Murray absolutely shares the objective of making sure that folks are able to get testing and treatment for coronavirus at no cost, and that in general, cost should not be a barrier to folks getting the healthcare services that they need. And that this specific bill, because it gets referred to the committee that she's the ranking Democrat on, just as a matter of policy, she doesn't tend to co-sponsor those bills because they're, brought before her committee. So that's all I was trying to explain on that particular front. But again, she absolutely shares the objective of making sure that folks are able to get treatment and testing at no cost.
Seeing some pushback here from the comments. So it sounds like, I'm not really clear if Senator Murray is really is going to push for the Healthcare Emergency Guarantee Act. So I guess let it be on the record that that's a huge priority for our group, for healthcare as a human right. We hope that she can help push that through the Senate. And I think we've got time for one more question. I think it's going to go back to Senator Nguyen here about small businesses and what the support the state can give to small businesses that have gone out of business and have lost everything.
Yeah, so there's a few things. I think there's a whole spectrum of stuff, right? So in talking to businesses that have either had to shutter, so a lot of retail or restaurants because of it, offering either low interest or grants to be able to hire people back, have inventory, and then open back up. There's also what you can do is do a tax deferral, which is what's happening now, but I would advocate for forgiveness for specific instances for small businesses who are struggling right now. I would actually have a mitigation fund as well to either help them recover from some of the debts that they've been incurring. Those are some of the things that we're working on at the state level to figure out how that might look. But I think a lot of it is get the money to get them back open. If there are tax obligations that are hindering that ability, either work out a plan or forgive them as a whole. But it's going to take that one specifically, a partnership with the local communities as well, because candidly the state just doesn't have enough funding for it. And one thing I do want to call out is that oftentimes our undocumented neighbors are left out of this conversation, and having a relief fund specifically for either small businesses or communities for undocumented folks, because the federal government has been so drastic in terms of their lack of support for those communities as well. I would advocate for a relief fund specifically for that demographic of people. Right now, we have about $1.5 billion left in the COVID funding. It can only be used for COVID-related issues. I think for now, there may be some flexibility in the future, but there's some funding that we can potentially play with to help out in that capacity.
Thank you so much. And I know that we didn't quite have time for everyone's questions. I really appreciate everyone engaging in the chat, and I'm going to pass it back to Nathan. Thanks so much.
All right. Thank you very much, Sam and Faithiya, and all of our guests. Thank you very much for joining us. We really appreciate the discussion. Right now, I'm going to hand it off to Margaret Carey from Seattle Indivisible and also from the Healthcare as a Human Rights Steering Committee, and she is going to set up our breakout groups.
As Nathan said, I'm going to be talking about breakout groups. So before we get broken up into different groups, I'm going to talk about what we're going to be doing. So the first question is, what actions can we take to build momentum behind the Healthcare Emergency Guarantee Act? As you know, the Washington delegation, our representatives in Congress, in the House and the Senate, are not all on board. So what can we do to change that? Number two is, what actions can we take to build momentum for Senator Nguyen's proposed higher earners payroll tax and capital gains tax, or other ideas for progressive revenue? So under those two questions, there are some thoughts. What can we do? Can we do emails, calls, healthcare stories, What can we do to with our groups that we're affiliated to take action? So with that, our facilitators are going to let us all go into breakout groups, and we'll see you in about 15 minutes. Thanks. Welcome back, everybody. It is terrific to see so many activists, so many organizational representatives in one space. And part of what's so wonderful about our group is that we have a lot of very thoughtful, strategic people among us, and activists who want to take action. So I'm going to call out and I'm going to ask one of our experienced activist leaders, Gina Owens, to kick off with a report back on what are some ideas for how we can be most effective to support our this Healthcare Emergency Guarantee Act, and what are ways in which we can build momentum to support efforts towards progressive revenue in our state legislature. And thank you, Gina, for stepping up to kick off our discussion.
Sure. So some of the things that we talked about in our breakout room, one is we talked about some of the state lawmakers who are not yet signed on in support of the HCHR-WA, and I'm sure we didn't get them all, but we did come up with Kilmer, Schreier, and Heck. Some of the ways that we wanted to get their support and other state lawmakers who are not supporting is pledge cards for officials who aren't yet signed on. They can sign a pledge card letting their constituents know that they are going to support it. One of our people in the group, Lisa Decker, talked about racial disparities being very important, and we shouldn't allow them to just walk the walk. They need to also talk the talk. Candidate events. Some of us need to be showing up to each of those candidate events and asking specific questions to pin them down, and also calling, emailing, personally going to their offices and talking to them. All of that is important.
That's a great summary, Gina. Thank you so much. And for many of you, Gina has participated in all of those events, so she speaks with experience. How about someone else among the report back folks? Who would like to jump in? We'll just do a couple more.
I could go for my group really quick. I'll try to keep mine really short, but what we talked about that I didn't hear Gina mention already, because Gina really covered a lot of it, which is great. Earned media, just making sure that the story of the Healthcare Emergency Guarantee Act is heard loud and far and wide. And also putting it in giving the racial justice lens, making sure that we're talking about, what the delivery of care looks like right now, and how poorly or how disproportionate health outcomes are, and how that's just obviously a racial justice issue, and there's such an easy solution. So really putting it in that frame. Also wanted to just take a moment to talk about on the state level, the supporting progressive revenue. We want the big thing there, no matter how we go around it, especially to talk about an income tax, it has to be education. We have to inoculate just the entire voting base of the state. We're in a kind of a progressive bubble in this room, where a lot of us are pretty, I would say I think everybody in the entire audience is probably favors an income tax, but if you polled Washington State, you're not going to get there. So a lot of it is just like, getting people to understand why we have why and how we have a regressive tax structure, and how an income tax would actually benefit them. Also, just electing leaders that would support it, and then also, and that's a long-term battle. Bevan was in my group, and she pointed out, we probably have to do it at the ballot box, because the latest court ruling shot it down. So in the meantime, we are going to have to really build around these packages for progressive revenue, like the stuff Senator Nguyen was talking about in closing loopholes. So yeah, I'll leave it at that so that we can have time for other folks.
Thanks everyone for doing a great job, and we'll be monitoring the legislators on progressive revenue votes because we know capital gains has not passed, and that's with a Democratic majority in the House, Senate, and the governor's office. So I'm just going to move us quickly to talking about whether we're, whatever we do, whether it's an email or a phone call or a march, a personal visit, it's going to really make a difference. So we just want to, for all of us, emphasize that even if we just do that phone call or that email, it's going to make a huge difference. And I'm going to pass it back to Nathan to do the honors.
Perfect. If you don't mind, we're having some of us are having a hard time seeing the raised hands. I do want to call on Bonnie Morris and then also Pam Delan, because I see those two raised hands, and then we'll wrap it up. Go ahead, Bonnie, first, because you're top of my screen.
In our group, we talked more about the Healthcare Emergency Act and not as much about progressive taxation. But one thing we talked about is scheduling meetings in person with the senators' aides, because oftentimes you just get these form letters back when you send letters to them or email them, or sometimes when you speak with an aide over the phone, they'll say, I don't, I'm not sure how she feels on this subject. She hasn't put out a press statement. The other thing that David came up with is that the organization Social Security Works has a monthly call with the senators, and that could be a time where trying to hammer out and get their support during that monthly call.
Great idea. Great. Pam, did you want to add to that?
Thank you. We had Rick Wire in our group, and he's put a link up here in the chat. His brother does radio songs with catchy tunes that highlight things, and you can also get him to do what topic that you're interested in him doing. I thought that was a nice, novel approach. I think that for myself, getting our group in touch with the leaders of the resistance movements now that are going forth with ideas to help the Black communities would be a good way to amplify what needs to be done at the state level in a group that really has attention, and also how the Healthcare Emergency Guarantee Act could help their groups to be have the wellness resources they need when they get done with their parading and marching and find out they don't feel good.
Thanks for your thoughts, suggestions, and I really appreciate it. Sorry, I missed a couple of hands there. So with that, please send notes to the email address that's posted in the chat. With that, thanks.
All right. Yeah. Thank you very much, everybody. Well, I see one more raised hand from David Loud. David, go ahead really quick.
The sign-on letter that was sent yesterday to the whole congressional delegation, signed by 72 organizations. It's a very impressive list of organizations: labor, community, immigrant, faith, healthcare. And the reason I say that is that I think we should make use of that letter. And when we're talking with the congressional delegation or the candidates for office, and by the way, Gina, Denny Hick is out of the picture. He's not running anymore. We had on the call tonight Beth Dolio, who the Labor Council has endorsed. She's wonderful, wonderful, wonderful as a candidate for the 10th congressional district. But anyway, my point is, let's make use of that letter. Everybody will receive it in our next newsletter. There'll be a link to it. Print it out. Have it in your hand when you talk to people and say, wait a minute, what about all these organizations? Don't you want to take that seriously?
Just any dialogue you ever have with an elected official around healthcare until we see this through. I mean, we have bills that we support. If they're wishy-washy, you can always just push on principles. What are you going to do about guaranteeing healthcare as a right to all people in this country? What are you going to do to detach healthcare from employment? And what are you going to do to take the for-profit out of health insurance? Like those three principles, among others. So, but you can hold their feet to the fire like that as well. So we're gonna bring some energy here for the very end of this meeting. I have to make sure I got this chant just right. So we are gonna do a shout out, and I guess I'll start with this shout out. But so this shout out is gonna be no healthcare, no justice, no justice, no peace. No healthcare, no justice,
no justice, no peace.
No
healthcare, justice, peace.
So thank you, everybody, and we'll all be in touch soon. There will be a follow-up email with all of our calls to action, and thank you again very much, everyone. We really appreciate all of you. This is all of our work, and thank you again.
Good night, everybody.
Good night,
everybody.
Bye.
Wonderful.
And tell them to save Medicare as we know it and expand it into Medicare as we need it. Improved Medicare for all, because your interests are special too.